Alright, hi everyone. I hope you guys are having a great day. So during today's lecture video, we are going to carry on talking about prenatal development, and then we're also going to talk a little bit about development in infancy today, and we will carry on with that discussion in the next lecture video as well. So a couple of announcements. Remember that you do have your activity this week that's going to be due by Friday at 5 p.m. Please remember that that deadline is firm. It needs to be done by Friday at 5 p.m. Also remember that if you use any sources, you have to cite those appropriately, but you're not required to use any sources. I'm looking for you to give me your thoughts combined with information from the lecture video, but if you do use sources, please make sure to cite those appropriately. And also remember that if you are using sources, I want the majority of your response to be your response, not information from other sources. I want to hear what you have to say about the activity. So let me know if you have any questions about that. Also, looking ahead, before too long, we're going to be having exam 1. So I will talk more about this during the next lecture video, but I will be posting a review video to help you guys prepare. But if you would like to go ahead and start looking over your notes and getting ready for that, please feel free to email me with any questions you have as you study for exam 1. All right? Let me know if you have any questions. Otherwise, we're going to go ahead and get into lecture. Alright, so as I said, today we're going to be focusing primarily on prenatal development, and then we will also start development during infancy at the end of this lecture video as well. So we started these slides last time talking about how we have a sperm cell from biological dad, we have an egg from biological mom, they come together, they form a new creation here, and we're going to be talking about 3 periods of prenatal development. And these periods are not the same length, so they don't split up evenly. So we're not talking about first trimester, second trimester, third trimester here. We're going to have the period of the zygote, and then we're going to also have a period for the embryo and the fetus. So the period of the zygote is just the first 2 weeks of pregnancy. So during this time, a woman is probably not aware that she is pregnant. And you'll see a picture on the next slide that will illustrate some of this information, but basically what happens is that fertilization, so the combination of the sperm and the egg, happens in the fallopian tubes, and then we have a zygote, and the zygote is going to travel into the uterus and implant there, and when the zygote successfully implants, then you have hormonal changes that will then cause the woman to prevent or to stop menstruating, so it stops menstruation, and then the woman is likely to miss her period, and this may be the first sign of pregnancy. And usually a pregnancy test would be accurate from about the time that a period is expected, although it is possible perhaps to get a positive before that time, but a negative before that time could potentially be a false negative, just need more time for that hormone level to build up for a test to be able to come back positive. So the zygote is going to contain the cells, obviously, that will develop into baby, but it's also going to include cells that are going to form the placenta. Now, the placenta is going to be an organ that provides nourishment to baby, that's going to provide a connection from mom to baby so that resources, nutrients, oxygen, that kind of thing can be passed along. So you have a little bit of a picture here of what I'm talking about. So ovulation means that the egg is going to be released from the ovary. It's going to go into a fallopian tube, and then that is where fertilization takes place. Now, yes, it is possible sometimes for the zygote to attach somewhere other than the uterus, so maybe attaching like on the fallopian tube, for example, and that would be potentially an ectopic pregnancy, which is dangerous for mom and would not be considered a viable pregnancy. But for the most part, the zygote is going to travel after fertilization, is going to travel down and is going to implant in the uterus. And then once that happens, then there are hormonal changes here that can be picked up on a pregnancy test. Mom's going to miss a period and may start to be aware that she is pregnant. Now, that first period only lasts for a couple of weeks, and then we have the period of the embryo, and this is going to last from weeks 3 to 8. Remember that a typical pregnancy would be 40 weeks. And so we're just talking about still that first part of the first trimester here. So during the period of the embryo, a lot of really important development is going on here, and so this is a time period where we want to be very cautious about things that could be potentially dangerous. We're going to talk about some things to avoid here in a few minutes, but a lot of development happening So if you think about the cells that are developing at this point in time, they're going to have to form into all of the different organs, the different structures of a body. And so there are three major parts of an embryo: the ectoderm, the mesoderm, and the endoderm, and they're going to have to form into all of the parts of a body. So each one of these is going to form into many different types of cells. But an ectoderm, for example, would part of what it would develop into would be the nervous system, skin, nails, hair, that kind of thing. The mesoderm would involve some of those internal organs, things like the respiratory system, and then the endoderm would also have other internal organs, things like a digestive system, although of course all three of these are forming into essentially all the parts of a body. Now, in addition to what we have going on with the embryo, we're also going to have the amniotic sac filling with fluid. That fluid is there to help provide cushioning, to help protect the embryo, and then the umbilical cord is going to connect embryo to placenta, and then placenta will be connected to mom, so that we have a flow from mom to baby of the nutrients, oxygen, things that you need to develop. So we're going to have this connection here, and of course there are many things that can go wrong at this point, placenta issues, that kind of thing, but for the most part we have a healthy connection from mom to placenta, healthy connection from placenta to baby that allows for the flow of necessary ingredients for life. Now, it talks here about the neural tube developing. This is very important because the neural tube is going to grow into the brain and spinal cord. Now, it is possible for a baby to have a neural tube defect, to have some kind of issue here where the neural tube doesn't fully close or doesn't fully develop. Of course, we cannot avoid all these cases, but one thing that is recommended is that women who are pregnant take prenatal vitamins so that they're getting enough folic acid, which is something that seems to be associated with healthy neural tube formation. So it is recommended that women take prenatal vitamins, perhaps even before they get pregnant, if possible, especially if you're trying to get pregnant, so that a woman can have enough folic acid there for appropriate neural tube development. All right, and then from weeks 9 up until birth, as I said, we typically think of pregnancy as being 40 weeks long if you go all the way up to your due date. During this time, we have the period of the fetus, and so this is going to be the last part of the first trimester and then all of the second and third trimester. So we're going to have several slides worth of things that are going on during this long stretch of time. One thing is that you'll see a differentiation between ovaries and testes depending on the sex of the baby. Now, this is where you start to have a differentiation. That does not mean that you can see on an ultrasound at this point whether we're carrying a boy or girl. And that's something that's usually seen on ultrasound around the middle of pregnancy, so around the 20-week mark is when most people find out. Sometimes you can do like a 3D ultrasound or 4D ultrasound earlier on, maybe 15 or 16 weeks, and find out. But at week 9, this is where we're starting to see a difference in development for males and females. It talks about the circulatory system here. It's beginning to function in earnest, beginning to function more effectively. But you actually have a heartbeat from beginning around 6 weeks of pregnancy, although you may not be able to detect that heartbeat with a Doppler, so you may have to see that on an ultrasound. For example, with my last pregnancy, I was able to see my son's heartbeat at 8 weeks on an ultrasound. We would not have been able to find that on a Doppler at that point. All right? And Doppler just being the handheld device that the doctor uses to listen to heartbeat. All right, so some other things that are going on. Around week 16, it says movements are felt by mother. There are a lot of things that can impact when a woman first feels the baby move, which can be called a quickening. If this is a first baby, it may take a little bit longer, whereas if a mother's had several children, she probably feels it a little bit earlier. It may be because mom is more aware of what it feels like, and so that could be one thing. Maybe earlier we're missing them because we don't know what it feels like for a baby to move, but with future pregnancies we know what it feels like. But it could also be the case that a woman who's carried many children might then, her muscles might be a little bit thinner, and so perhaps we can feel things a little bit more there. Also, the body style of mom, so if mom is a little bit heavier, then it'll take a little bit longer to feel movement as well. Also, the position of the placenta. Usually the placenta is embedded towards the back, but sometimes you can have an interior placenta, so the placenta is at the front of the stomach, and then could be cushioning movement, so it may take longer to feel movement then as well. Around week 20, so about halfway through pregnancy, that's where we can see things like eyebrows, eyelashes, hair coming in, and also the skin is protected by what they call a vernix, or vernix caseosum. The thing about the vernix is that it is intended to protect the skin. So if you think about the fact that baby is in amniotic fluid for a very long time, and skin could potentially be damaged from being in liquid that long, so this helps protect the skin. And if a baby is born early, then sometimes this vernix, this substance, is still on the skin because it hasn't had a chance to shed yet. Usually it will shed towards the end of pregnancy. So it is possible that babies that are born early could potentially still have some of that. It talks about the age of viability here as 22 to 28 weeks. The age of viability is where we would start to think there's a possibility of a baby surviving birth. Now, obviously, we would prefer for babies to go to term. That's the healthiest situation typically. However, sometimes there are health conditions or things that cause mom to go into labor early. Or baby needs to be delivered early. What we have seen is that babies can survive at a very early time period. I believe, I did a little research, I think the youngest baby to survive was 21 weeks and 4 days, but that's very rare at that point. However, because of modern medicine advancements, babies that make it to 24 weeks and more than that are at least given a pretty good shot because of all the technology that we have. Usually once we get to somewhere around week 28, we feel much more confident. Not that that's a guarantee, but that babies are much more likely to survive and to have a healthy development after that point. But of course we want baby to stay in until due date if at all possible. Now it talks about the senses being active here. So there's research to suggest that baby may be able to remember voices and music. So sometimes we maybe sing to baby, read to baby, play music so that baby can start to recognize voices. And then be comforted by those voices after delivery. It talks about taste here, so there's some research to suggest that the kinds of foods that mom eats during pregnancy might then be foods that baby likes a little bit more later, potentially because of exposure to it early on. The sense that's going to take longest to develop here is going to be vision. And of course there's not a whole lot to see in a womb. However, there is a certain point where if you flash a light on a woman's stomach, baby may react to the light. So just seeing a difference between darkness and light, like kick the flashlight, run away from the flashlight, that kind of thing. Alright, now some risk factors to keep in mind. Nutrition is very important during pregnancy. So in addition to trying to eat healthy foods, making sure that someone's taking a prenatal vitamin, we need to make sure that mom is getting adequate number of calories. So it depends a little bit on mom's health and weight before pregnancy starts as far as how much weight a doctor recommends a woman gain. Usually somewhere between 25 and 35 pounds is the average of what is expected. But it depends on if mom's a little bit underweight or overweight. You might change that number somewhat. And so usually during the first trimester, mom doesn't need to eat any additional calories. And then in the second and third trimester, 300 or 400 or so, somewhere in there, extra calories a day could be recommended. But making sure that mom is getting nutrition, also trying to reduce stress as much as possible. Of course, babies are resilient and it's impossible to avoid all stress. But we would be concerned about majorly stressful events, major things like psychological issues, anxiety, depression, and others, as well as things like potentially abuse, like domestic abuse, or very stressful situations with marriages or work situations. Here we want to be careful of. It talks about mother's age here as well. There'll be some information, I'm not sure if it's in this set of slides or in the next set of slides, but some advantages and disadvantages to having children later in life. Certainly as mom gets a little bit older, there are genetic risks. We'll talk more about that later. But may also be some health risks if mom is older as far as mom's health. So maybe things like blood pressure issues might be a little bit more common. But then if mom is very young, that is also potentially dangerous. Just because a girl starts her period doesn't necessarily mean that her body is prepared to carry a child, and can be dangerous for mom and baby in that situation. Alright, so wanting to be cautious of anything that we can avoid that could potentially cause problems here, it talks about teratogens. So this is something from the environment that is considered a hazard. Certainly there are plenty of things we want to try to avoid, but specifically mentioned here fetal alcohol syndrome. Now, I want to be very clear on this. If there is a test question that asks what amount of alcohol is safe to consume during pregnancy and breastfeeding, on my test, the answer is none. Because the problem is we don't know exactly at what point it causes problems, and therefore it's safest to abstain completely. So fetal alcohol syndrome, it's a syndrome. When you see a syndrome, there's a collection of problems. So someone who has fetal alcohol syndrome, it's on a spectrum, so it could be very mild, could be very severe, and the severity is likely related to the amount of alcohol that mom consumed during pregnancy, but it could be other factors as well. So there are psychological problems here, so baby may have developmental issues, aggression, attention issues, that kind of thing, learning problems. But then there are also physical problems that can be associated. We can see some things in like the facial development. So sometimes fetal alcohol syndrome is very mild and we might miss it, or it might not cause many problems, but it can be a very serious issue. So certainly the safest thing to do is to abstain completely from alcohol during pregnancy as well as during breastfeeding. Baby's body is not designed to be able to handle alcohol. All right, diseases that can be especially dangerous, you see some of them listed here. So we're going to want to make sure that mom has had appropriate vaccinations, wanting to make sure that she's screened for illnesses that could potentially cause problem for baby. Some of these can be passed through blood, so we're going to have a direct connection between mom's blood and baby's blood, so it could be passed that way, or could be passed by contact during actual delivery. So it talks about herpes here, something that could be caused by the delivery. So if it's something that's going to be potentially a delivery issue, like passing through the vagina during delivery, then you might consider something like a C-section delivery, for example. And then it talks about environmental hazards. Certainly we have more research on this now than past generations had, and so we learn new things. It mentions x-rays here. There was a time in history where we didn't know that x-rays could be potentially dangerous for a woman to have during pregnancy. Of course, now if women have dental work or other x-rays done during pregnancy, then we want to make sure that we're wearing protection there to try to reduce harm. It talks about mercury here. Women are encouraged to avoid eating certain kinds of food, anything that's high in mercury, so being cautious about seafood. And then there are certain types of seafood that are especially high in mercury. But also, when women are pregnant, their immune systems are suppressed somewhat, and so anything that could potentially cause like a foodborne illness, then potentially we want to avoid that if possible. All right. So during pregnancy, or perhaps before pregnancy, a couple may consider genetic counseling. So this is something that's offered to women when they're pregnant if they would like to have a test done to measure risks of things like Down syndrome, that kind of thing, other genetic issues. But you may also consult with someone to do genetic testing prior to attempting to conceive, especially if there is a family history of some disorders that could potentially show up on these kinds of tests. Now, if we're talking about diagnosis during pregnancy, an ultrasound is something that most people are familiar with. Women usually receive at least one ultrasound during pregnancy, in the middle of pregnancy, somewhere around 20 weeks, to make sure that everything is developing appropriately and to screen for potential problems. The thing about an ultrasound is that it can show a potential problem but may not have a definite diagnosis here. So, for example, there are some soft markers for Down syndrome with, for example, the size of the femur, the length of the femur, but that's not something that is necessarily definitive. So there are other tests you can do, some of which are like drawing a blood sample, but it talks about amniocentesis and chorionic villus sampling. So this would be taking a sample. Amniocentesis takes a sample of amniotic fluid. Chorionic villus sampling takes a little piece of the placenta. So we're going to be doing this with a needle, either through a woman's abdomen or through the cervix, to take a little piece of the placenta. And with amniocentesis, taking a sample of amniotic fluid to test for potential malformations, genetic issues here. Of course, there are some risks associated with having these kinds of tests, so they would be recommended in high-risk situations, if there's a mother of advanced maternal age, or if there's a high risk of certain disorders, they may want to do this. But because of the risk of miscarriage, that kind of thing, they would not do this in a typical pregnancy, likely. All right, so the thing that women are probably most thinking about throughout pregnancy is, when am I going to go into labor, and what is my labor experience going to be like? Now, there's absolutely no guarantee of what labor will be like. The hours on this slide, some women would laugh at. It depends on the situation. And one pregnancy may be very different from another pregnancy in the same mom. So usually a first labor takes longer, lasts longer, and then subsequent labors are shorter. But that depends a lot on the size of the baby, the position of the baby. My second labor was actually quite a bit longer than my first labor because my second baby was quite a bit larger. Not as large as my third baby, but we were trending in a big direction there. But I digress. When we're talking about stages of labor, the first stage is going to be everything leading up to pushing. So we're going to go from the cervix being closed to the cervix being open, about 10 centimeters here. And this is something that can happen over a period of days or even weeks. And leading up to birth, a woman might start to dilate and then kind of stall out and stay at a certain amount of dilation for a while. But we're talking about all the time period leading up to being 10 centimeters. Now, it says 12 to 24 hours before birth. I mean, if we're starting off from not being dilated at all and then having rhythmic contractions that are getting closer together and getting stronger, then there's a pretty good chance that this will last, 12 plus hours. But could be longer, could be shorter. And then we go into stage 2. Stage 2 is the actual pushing and delivery of baby. So it talks about an hour here. Certainly there are women that have pushed for a lot longer than an hour, some women for much less. So once again, it depends. But during this time, baby is going to actually be born. And then during the third stage, this is where the placenta is expelled. So labor does not stop when baby is delivered. We also have to deliver the placenta. Now remember that the placenta is the organ that's been attached to baby, been attached to mom, and this organ is providing nutrition, oxygen, things that the baby needs. So this organ has to also be removed. I would think most women are not aware of the placenta being delivered because it's certainly considerably smaller than baby, likely. If we're talking about a full-term baby, certainly smaller. So you can see kind of a picture here of what I was talking about during that first stage. The cervix is dilating, and then after that, the second stage, baby is born. Third stage, the placenta is going to be delivered after that, and then mom's just healing from that point. So how do you prepare for something like this, especially when you don't know how long labor is going to last, you don't know what it's going to be like? Well, there are a plethora of classes that you can take. And of course, if you're not able to actually take a class in person, you can always watch videos on YouTube, because that's the time period that we live in, to learn more about this. Oftentimes, childbirth classes have the purpose of teaching mom how to handle pain, teaching a birthing partner how to help mom during delivery. So the idea here is that women can deliver children without pain medication. In most situations, that it's certainly a possibility, it's an option, and women may choose to do that because they're concerned about anesthesia limiting a woman's ability to push. So it depends on the type of anesthesia. So you have things like an epidural that would be administered in a hospital, put into the back there. Now with an epidural, you could have just the right amount of numbness, but you could also have too much and you're not able to push, or not enough and it's still extremely painful. But then there are other pain relief options, things that can be delivered through an IV, that kind of thing. But anesthesia may make it harder to push. Anything that makes it harder to push makes it harder to get baby out, which may then mean that a baby needs to be delivered with something like a vacuum or forceps. Now, when I say vacuum, it's not exactly like the vacuum you vacuum your carpet with, but it's not that different either, using suction to help remove baby, or forceps that essentially look like giant salad tongs being used to help. Now, of course, those instruments would only be used if necessary and have the potential to cause bruising or other issues with baby. So usually that's only used in an emergency situation when you need to get baby out quickly and baby is already in the process of being delivered, so C-section is not an option at that point. But of course, anesthesia has the potential to maybe cause issues with baby, especially if we got a little bit too much. So there are plenty of complications that can come up. One of the main concerns is making sure that baby has adequate blood supply and oxygen during labor and delivery. So sometimes there's an issue with the placenta. The placenta may start to come away, may have an abruption there, or something that cuts off blood or oxygen, so that's always a concern. And so for this purpose, a mother is going to have a monitor on that's going to show the heart rate as well as measuring contractions during labor or for a large part of labor. And so if baby's heart rate starts to be erratic or is not where a doctor would like it to be, then may end up having an emergency C-section. Now, we have seen an increase in the number of C-sections that women have. Part of this may be because of elective C-sections, women choosing to have C-sections, but it may also be that birth weight is trending up a little bit, and so for larger birth weight, we might prefer to have a C-section, that kind of thing. We're also going to have to consider the amount of pregnancy, or how far into the pregnancy we are, rather, when we're talking about birth complications. So you are much less likely to have complications in a full-term pregnancy. As I said, pregnancy is usually measured in 40 weeks, so we measure the due date. We predict that based on the last period, the first day of your last period, and we then go forward 40 weeks. And a due date is just an estimate. I think something like 5% of babies are actually born on their due date. None of my kids were born on their due date, but we're all about a week ahead, around a week away from their due date. But when we're talking about a baby that is born 36 weeks or earlier, that's where we might start to worry about things like low birth weight and other complications. There is a strong correlation between birth weight and other issues, things like being able to latch, being able to keep your body warm, so maintain body temperature, that kind of thing. So we would typically say a baby is usually somewhere between 5 to 9 pounds, and the average is somewhere around 7 pounds-ish, somewhere in there. A baby that's less than 5.5 pounds would be considered low birth weight, and then you see less than 3.3 pounds, very low birth weight, below 2.2 pounds, extremely low birth weight. Now, usually a lower birth weight happens because mom has gone into preterm labor, but sometimes you can have a growth restriction or an issue with the placenta that could cause a baby that actually has maybe term or close to term to be on the smaller side. All right, so what about adjusting to parenthood after baby is delivered? Well, we're talking about mom here on this slide. We're not talking about baby. We'll get to baby, but within the first couple of weeks after birth, it is a very significant transition period, especially for a first-time parent. So it talks about irritation, resentment, crying. So think about what a woman's just been through. In addition to the trauma, potentially significant trauma of delivery, you also have to think about the major hormonal changes, what your body has been through throughout the 40 weeks of pregnancy and beyond. And then you also have to consider the fact that you're probably not getting much sleep. You probably don't have as much social contact as you had before, not getting out of the house, maybe not able to prepare meals or take a shower or any of those things. And you can see how that would be related to a significant amount of stress. What we can see, however, is that women, in addition to the normal amount of stress and exhaustion that goes along with parenting, sometimes women experience postpartum depression. Now, postpartum depression would be considered something that lasts a little bit longer than this 1 to 2 weeks, and something that's a little bit more severe, so it's causing some distress, it's causing some dysfunction. It is associated with some developmental issues in baby, likely because mom may have a difficult time taking care of baby, taking care of herself. So during that time period, mom and baby can both be impacted, and so it's really important to recognize this and try to get mom some help as soon as possible. It talks about things like low self-worth, irritability. So these are things that you see in depression, generally speaking. But then think about what this would look like in a new mom who's had a significant change in her body, who might not be getting any amount of sleep, whose hormones are all over the place. And so hormone levels is one issue. If you're someone who has already had periods of depression before pregnancy, that increases your risk. Stress, lack of support. So mom needs the amount of support that she desires. You know, some people want grandparents to come and stay. Some people want, you know, just you and the baby's dad or whatever. And then some people want a lot of people to come over and help. So the best thing to do here is to respect mom's decision about what she wants as far as visitors are concerned. Breastfeeding is something that can help because it can help mom bond with baby, and because breastfeeding is something that's also helpful for a body to heal from delivery. Having said that, though, sometimes mom might need to be on certain medications that are not considered safe during pregnancy, or during breastfeeding. So if we're talking about treating depression, some medications are considered safe to take during breastfeeding. Some medications are not, so that's just something to keep in mind. Make sure you're talking with a doctor. Now, infant mortality is a difficult topic to talk about. We're going to talk about it kind of generally here. And then in the slides on infant development, SIDS will specifically come up. When we're talking about infant mortality, we're talking about an infant dying before first birthday. So period of infancy is really up to that first birthday, and then oftentimes people would consider a baby a toddler after that first year. Our mortality rate for infants is 7 out of 1,000, so just under 1%. Which, I mean, any death here is tragic. Any number here. There's not a number here that's going to be acceptable or okay unless that number is 0. But what we do see is that for an industrialized nation, our mortality rate is higher than some other industrialized nations. So there's work to be done here. One thing to consider is that oftentimes this is associated with low birth weight. So we talked about a baby that's 5.5 pounds or less. And this may be because mom doesn't have access to or doesn't utilize prenatal care, which is, you know, really important for a healthy pregnancy and a healthy mom. And then also it talks about absences from work here for mom and for dad as well. It is important for mom to be able to heal, to bond with baby, if at all possible, to have someone else there to help her care for baby, especially during those first couple of weeks. So there is work to be done here. You can see from developed nations here, we're kind of on the bottom as far as this, which means we have more or higher rates of infant mortality than a lot of other developed nations, although, I mean, Turkey is substantially, has substantially more infant deaths than we do. But then looking at the least developed nations, one thing to note, look at the numbers at the bottom. Even if these bars look like they're the same length, always make sure you're looking at all the information here. So this is measuring from 0 to 25. This is from 60 to 160 plus. So certainly infant mortality is associated with a lack of nutrition in mom, a lack of nutrition for baby after baby's born. So certainly there's a lot of different factors to consider there. All right, this leads us to our activity for this week, Activity 2. It asks your thoughts on having children. So we're talking about prenatal development. We're talking about development during infancy. So we're about to talk about some issues related to how many children you have and whether or not you choose to have children. So I ask for your thoughts on this. Do you want to have kids? How many kids do you think you want to have? Once again, this is something that you may not know at the moment. This is just your thoughts. You may change your mind one way or the other later, but at the moment, but also what factors do you consider when you think about your future and whether or not you're going to have children and how many children you're going to have, what factors are you considering? And I ask you to think about this for your activity because there's a lot of research on factors that influence how many children we choose to have, and the culture that you live in is huge. So remember that those activities need to be at least 200 words long. So in Western nations, when we talk about Western nations, we're talking about us and other Western nations, but individualized, individualized culture, so individualistic culture here. It says having children is a matter of personal choice, individual choice. This is not always the case in our culture. I think that it is now, though. In the past, perhaps we saw having children as something that was kind of a rite of passage into adulthood. And that's not necessarily the case now. We don't always just expect and assume that people will have children. However, when asked that question that I just asked you on the previous slide, 90% of adults in our country say they either have children or they plan on having children. And some of the factors that they list as being part of this decision, financial circumstances, career goals, values, this could be religious beliefs and others, health conditions, which may impact whether someone chooses to have children or not, whether to adopt children, that kind of thing. So when we're talking about advantages or disadvantages, it seems kind of strange to have a conversation about this, but it is good to be prepared and to know this information. So good things about having kids. I feel like it's hard to actually put into words why it's good to have kids. But certainly as a mom, I do feel like being a mother has been a wonderful influence on my life. Some things here, personal fulfillment. So this is something that potentially someone has wanted to do, something that they see as being an important part of who they want to be. Being a responsible and mature adult. This could be great. Sure, having kids could make someone become more mature and responsible. I don't think it necessarily does, though. I do think there are children who have mothered, or children. Well, yeah, children. But anyway, I do think there are people who have mothered or fathered children that are still not mature, but this could potentially help. Caregiving and support in old age. This may be more of an advantage in collectivist cultures where people tend to take better care of their parents. But in our culture, also, potentially, having someone take care of you when you get older. Continuing the family name, which is something that it could be considered important for you. We certainly sometimes put a lot of pressure on only sons to have sons to pass on the family name potentially. Strengthening a couple's relationship, absolutely. Having kids can be a wonderful bonding experience, but then it can also be a major source of stress. Imagine having your typical conversations or discussions or disagreements when you haven't slept in 8 years. That's kind of what that feels like. Adore my husband, adore my children, just being real with you guys. But I love being a mom. But some disadvantages here potentially, there is a lot of responsibility, and that can be very stressful. Not that being responsible for someone's well-being is a bad thing, but it can be very stressful. It talks about role overload here, so if we're trying to work and take care of kids and take care of domestic things in the home, certainly that can become very stressful. Financial strain, I don't recommend Googling. I don't recommend calculating how much money you spend on diapers or how much it costs to have children. You don't want to know. I don't recommend that, but it's a lot. Loss of privacy, sure. If you enjoy having an audience while you go to the bathroom, then Parenthood is for you. That's all I'm going to say about that. But how many children are you going to have if you choose to have children? Well, the average number of children that a family has declined in Western nations, which would include us, since it talks about the 1960s. One reason why this might be on a decline is birth control options that may be cheaper, maybe more available, different types of birth control, so pills, patches, implants, that kind of thing. Also, more women are working outside of the home, which can play a factor in how many children a couple decides to try to conceive. It talks about divorce here. The divorce rate is about 50% in our culture, or slightly above. We're going to talk more about this later in the class, but a couple that divorced might then have fewer children than they would have if they had stayed married. But we do see that mothers who are living in poverty are more likely to have more children. Potentially this could be because of not having access to medical care, which can include birth control options, that kind of thing. Now, one thing that we see is that mothers are getting older, and part of this, I think, is because of more people going to college. I think We are waiting until we're older to get married, and then also having children at a later age. Some advantages here as mothers get older. Now this is talking about American mothers, and on average it has increased, but there are regional differences. I think mothers in the South still are a little bit younger than in other parts of the country. But advantages here, when you're older, you might be more emotionally mature, so the frontal lobe of your brain does not fully develop until around age 25, so certainly there's a lot of maturity that happens around that time period. And then life experiences might help a woman be more prepared perhaps, but then it also talks about financial stability, so a woman that's older might have more of an established career, have more money in savings, that kind of thing. But one thing you will see is that it is harder to conceive as you get older, so usually the sharpest decline happens after around age 35. A mom that is older than 30 might have some decline in reproductive capability. This is true also for fathers as well, although not quite as much as it is for mothers. But in addition to being harder to get pregnant, there's also a higher risk of genetic disorders, chromosomal problems there, especially with older mom. So things like Down syndrome are more likely, but also some new research is suggesting that an older father could potentially increase risks as well, although not as much as an older mother. Alright, so that's the prenatal slides, but as I said today, we are also going to do a little bit on infant development as well. So we've talked about everything from fertilization all the way to delivery of a baby. So now we have a newborn. We're going through the lifespan. Now we have a newborn. What's the newborn up to? Well, first of all, reflexes, very important. It says that a newborn is born with reflexes. These are unlearned responses. Now, some of these have survival value, so something like rooting and sucking would help a baby to find food and be able to eat. And a baby that is born premature or that has nervous system problems could potentially be lacking in these reflexes, and so might be difficult to feed, that kind of thing. Other reflexes, though, are just signs of voluntary motor behaviors that will happen later, so things like a stepping reflex. There's also a swimming reflex, so newborns, I'm not recommending that you put a newborn in the water in an unsafe position, but newborns can do kind of a swimming motion there, so there's some survival value to that as well as motor behaviors that are developing. And as I said, your reflexes can be a sign of appropriate levels of development. So after baby is born, we're going to need to assess the health of baby, and one way they do that is through an Apgar score. So usually that you get an Apgar score immediately after delivery and then another one a few minutes later. And the Apgar score is made up of your score on 5 different things, and you can get from 0 to 2 points. So if you got 2 points for each of these 5 things, then that would be an Apgar score of 10. Or you might lose a point here or a point there if something is not perfect here. But you're going to measure baby's heart rate, breathing, muscle tone, reflexes. It talks about skin tone here. So baby who comes out crying is obviously getting enough oxygen, and then therefore that impacts skin tone. I know that when my first child was born, he didn't cry immediately. He cried very quickly afterwards. He was totally fine. But I remember the first thing I saw, the doctor was holding him, and I could just see this little purple foot. That's what I could remember. It was almost purple, but just for a second, and then he started crying, and he pinked up after that. But they're going to measure each of these things and give a score. Now, a higher Apgar score is better. It's suggesting that baby is in good shape. But you see an Apgar of 7 plus means baby is probably in good condition. The higher the score, the better. 4 to 6, baby may need special attention. For example, if baby is having trouble breathing, we might need some oxygen, that kind of thing. 3 or less means that we are absent some of these things. There's a 0 on some of these things, and so that could be a potentially life-threatening issue here. There are different types of delivery. You know, you can deliver at home, you can deliver in a hospital or in a birthing center, but an advantage to delivering in a hospital is that if there is some kind of complication, there'll be doctors on hand to address those. Okay? Now, what kinds of things does a newborn do? Well, not a whole lot. They eat, they sleep, they poop, pretty much. But you have periods of alert inactivity, where baby is awake and calm. Eyes are open, baby's just chilling. Then you might have waking activity where baby is moving around, squirming. Not that these motions are very coordinated. Baby doesn't have much motor control yet, muscle control yet, but baby is squirming. Eyes are open, kind of looking around a little bit. So you do see this. You spend a lot of time, baby spends a lot of time crying and sleeping. Crying is, in and of itself, not a bad thing. It's the way that a baby communicates that they have a need. They need to be fed, they need to be changed, or they're tired, that kind of thing. But some babies cry more than others, which could be based on temperament, could be based on level of development. Sometimes babies are crying because they're seeking comfort. Maybe baby has some distress, so it could be something like colic, so digestive issues, that kind of thing. Lots of different reasons for crying. And then sleeping, of course, there are different states of sleep, but baby's eyes are closed, breathing, all that good stuff. Now, when we're talking about crying here, you may learn to decipher your baby's cries. At first, it's just kind of guessing, but pretty soon you may figure out what your baby wants. And this just comes from practice and time. So, basic cry starts off softly, builds in volume. This may be the child is hungry, so it's kind of beginning with a fussy, whining, and then if baby's needs are not met pretty quickly, baby will let you know that he or she is not very happy, and then could escalate into an angry cry that's more intense and louder. Some babies go straight to the angry cry, but a lot of babies have kind of a build-up before that. But you can tell a difference between an angry cry and a pain cry. When a baby is in pain, there is often a pause. So you'll hear an initial very loud pause, and then it's like baby stops, almost like baby's going to swallow, going to gasp, and then after that pause, then there's more screaming. If you've ever been around a baby when they got like their vaccinations, that kind of thing, you'll hear this, you'll learn to recognize this. So you figure out what their cries mean. You also figure out their sleep cycles, which vary greatly from baby to baby. And a lot of variation here is normal. Don't ask a new mom if she's sleeping. She's not, and she doesn't need you to rub it in. All right. Newborns sleep an average of 16 to 18 hours a day, so you might wonder, why is it that moms are so exhausted? Well, because they don't sleep 16 or 18 hours in a row. Now, we're going to go with these numbers because this is what's in your textbook, but I have never yet had a 6-month-old that slept 12 hours at night. But a newborn usually has a cycle where they'll sleep for about 3 hours, be awake for an hour. There is a wide variation in this, but usually newborns don't stay awake for more than an hour or so at a time. And then as they get a little bit older, then these cycles get a little bit longer. They stay awake for longer periods, maybe sleep for longer periods. It talks about 6 months. By 6 months, a baby is maybe physiologically able to sleep 10 to 12 hours a night. So a lot of this has to do with weight, as far as how often the baby needs to eat. But just because a baby doesn't have to eat in the middle of the night doesn't mean baby won't wake up wanting to eat. So wide variation with this. When we're talking about REM sleep, this is rapid eye movement sleep. This is that period where you dream. And we see that newborns have more REM sleep than you do at any other point during your life. And the thought is that it provides brain stimulation that is important for babies because they're not able to get as much stimulation from their environment. They're just not developmentally ready for that yet. And so they get this neurological stimulation from dreaming, from REM sleep. And then that will decline as they get older. Now, when we're talking about sleep, let's talk about sleeping arrangements. We live in an individualistic culture, and it talks about independent versus interdependent. So individualistic would also be another way of saying independent. Interdependent would be collectivist cultures. In our individualistic culture, we are less likely to co-sleep. Now, there are different meanings behind. So co-sleeping is talking about having the baby in the room with you, which is definitely recommended. Bed sharing would be the practice of having the baby actually in your bed, which is something that also is perhaps on the rise in our culture, but is not as common as it is in other parts of the world. So co-sleeping is the norm for 90% of the world's population, but not for us, because we live in an individualistic culture where we think we want baby to be independent, so we want to teach baby from the very beginning to be separate from caregivers. Having said that, though, you can see why baby might resist that. Parents, caregivers are the source of comfort and nutrition and safety, and baby is hardwired to seek out after things that are good for baby's survival, which being around a parent is. So you can understand why baby would want to be with parent. Co-sleeping is increasing, perhaps because breastfeeding is more common. Now, is it potentially dangerous to bed share with a baby? Yes. Certainly there are ways to do this that are dangerous. So if you're in that situation, you want to make sure that, and I'm sure there's this information that's coming up when we talk about SIDS, but making sure that there's not blankets or very soft surfaces, pillows, stuffed animals, anything that the baby could suffocate on. You want to remove toys, stuffed animals, all that from the sleeping area. You need a firm surface. You want to have bed rail, if possible, that kind of thing. You want to make sure that baby is placed to sleep or put to sleep on baby's back. You want to make sure that you are not suffering from a sleep disorder or under the use of a substance, or you under the influence of a substance, using a substance. So certainly there are things to avoid there. So we'll go ahead and talk about SIDS, which stands for Sudden Infant Death Syndrome. This is a difficult subject to talk about, a very serious issue. Unfortunately, we are not able to predict or prevent all cases of SIDS, but there are certain risk factors that we can try to reduce if possible. So it talks about SIDS being the leading cause of infant mortality, which, as we said, our rate is about 1%. It's most often going to happen during 2 to 4 months of age. The thought is that before 2 months of age, baby has these reflexes that could potentially prevent this from happening, but then around 2 months, those reflexes start to decline a little bit, but also at that time, baby's not very mobile. So when baby doesn't have the reflexes to protect himself or herself, but then is not yet mobile, maybe baby might get stuck in a position where he or she can't breathe and then is not able to roll over. So then once baby has more motor skills, then the risk does decrease. Now, what are we going to do to try to reduce the cases of SIDS? Well, it talks about premature birth and low birth weight. So something that we can do would be to make sure that moms have adequate prenatal care, adequate nutrition during pregnancy, trying to make sure that pregnancy goes to term as often as possible. Smoking is something that is dangerous, so baby should not be in a home where parents smoke. So parents should try to stop smoking. Smoking during pregnancy is dangerous, as a risk factor, but then also if someone else in the home is smoking, if at all possible, stop smoking. If not possible, smoke outside, and then make sure that you change clothes before you handle baby, that kind of thing. It talks about overheating, so making sure that baby is not dressed in extremely hot clothes, or making sure that the temperature is comfortable. Sleeping on your back is considered safest. And part of this is cultural, so it talks about, research has suggested that African American babies are more likely to be put to sleep on their stomach. Also, I think it depends on the age of the caregivers, because previous generations were told that to put babies to sleep on their stomach. I'm pretty sure my mom put me to sleep on my stomach because at that time that's what we thought was the safest thing. But today, research suggests that the safest position for baby to be is on their back. It's not just about having baby's face covered, which is a risk, but it's also other things that happen when baby's on their stomach that just make it not the ideal breathing position for young baby. Now, when baby gets old enough to roll over, then that's less of a risk, but still could potentially be a risk. All right, so things we can do to try to reduce SIDS. Smoking and drug use is dangerous. Babies that are exposed to secondhand smoke can then develop lung problems, breathing issues. Anything that makes breathing harder for baby makes SIDS more likely. It's usually a breathing issue. But also, parent that is taking drugs may not be able to attend to baby adequately, or if baby's having a problem, may not be able to get to baby in time. So we want to put babies to sleep on their backs. Even if baby is able to roll over, baby should start night out on their back whenever possible. As I said, remove soft bedding, pillows, blankets, stuffed animals. Anything that is soft is a suffocation hazard. Pacifier use. I understand that the use of pacifiers is kind of political here, but the thought is that babies that sleep with a pacifier, they don't drift off into sleep as deeply as babies do who are not using a pacifier. So the thought is that then it helps prevent some cases of SIDS. But then also babies that are breastfed. It's not on the slide, but it's a significant advantage of getting breast milk because breast milk does not fill baby up quite as much, so baby is more likely to be in a lighter state of sleep, wake up more often to feed, which then can help reduce the risk of SIDS. All right, just a little bit here on temperament in a baby, which is somewhat related to personality. I mean, when we talk about temperament in a baby, we're essentially saying, is this an easy baby, or is this a baby that's very difficult to settle, a very moody kind of baby? The baby that likes things to be just so, potentially. What is it that impacts that? Well, it talks about cultural, ethnic factors here. In our culture, we tend to have, in general, we show more emotion. We tend to be more emotional, and I think that plays a role in temperament to a certain extent. The way that we parent, whether or not we respond to baby. It talks about responsiveness helping reduce an infant's emotionality. So if a baby knows that he or she has a pattern of having their needs met, then baby may not panic. When baby needs something, baby will cry, but baby will trust that mom or dad or caregiver will provide that. We do see a correlation between depression in mothers and then anxiety in infants. And this is something that could be nature, could be nurture. It could be that because mom has a predisposition towards depression, then baby might have a predisposition towards depression and anxiety, but it may also be caused by parenting practices in mom that are associated with being depressed. We just see a correlation here. We don't know exactly causation. All right, a little bit here on growth. So growth is very rapid during infancy, so there's not really any other time period where we're talking about doubling and tripling our weight. But babies on average double their weight by 3 months, triple their weight by 1 year. Now this is average, and you're going to see a pretty wide range here. Doctors just like baby to be on a pretty steady curve. If baby suddenly starts gaining a lot of weight all of a sudden or stops gaining weight, then that's something that's unusual for them. Then that could be a cause of concern. But there is a great variation here. Part of this is due to genetics. If you have taller parents, you're more likely to have a longer baby at birth, and baby may end up being taller, and so you may see more growth there. So part of it is genetics, but part of it is also based on nutrition, whether or not baby is receiving adequate nutrition. And it is important for babies to receive the right types of nutrition. So for the first, according to recommendations, for the first 4 to 6 months of life, baby's diet is entirely made up of either breast milk or formula. And then baby should continue to receive breast milk or formula up until at least 1 year. There are some estimates that suggest, or some recommendations, that you should breastfeed longer than a year, up to potentially 2 years, depending on ability, comfort level, that kind of thing. What we see is that babies have a lot of growth going on and a lot of motor skills developing, so they need a lot of calories. There is a lot of research to suggest that breastfeeding is the healthiest way to feed a baby, but of course fed is best, and you have to keep that in mind. There may be situations where mom may not be able to breastfeed, could be health problems, psychological issues, medications that mom needs to take, could be latching problems in baby, that kind of thing. It talks about breastfeeding and bottle feeding, but I want to suggest that there is a third option here that's a combination. Some women exclusively pump, so that would be pumping breast milk using a breast pump. There are electronic breast pumps that are available through insurance usually, and then feeding baby potentially exclusively breast milk, but they're getting it from a bottle rather than directly from the breast. So there are advantages and disadvantages here. So if you have, if you're bottle feeding, then another family member could help give some of the feeding, so maybe mom could get a little bit of extra sleep here. And certainly formula can be helpful for children. It depends on their health conditions. So sometimes babies are very sensitive to certain things, dairy, soy, that kind of thing. So a baby may need a specialized formula. Occasionally mom's breast milk might not have enough calories, and so they might recommend kind of fortifying breast milk with formula, that kind of thing. So what we see is that after the first couple of years, growth slows down. You continue to grow, obviously, but not as much as you do during those first couple of years, and the finicky eating starts. Although some babies are finicky from the very beginning. My first child, extremely picky. My latest addition, less so, but I guess my middle child's kind of somewhere in between. But talking about finicky eating here, it could be helpful if you think about children trying to avoid eating something that could be potentially dangerous to them. It does make sense for babies to be cautious. Just recently I introduced chicken baby food to my youngest, and yeah, let me assure you, he did not think it was good for his survival. He did not forget it either. He was making sure everything else I was feeding him was not that chicken baby food. Alright, very good. Why would you make chicken baby food? Anyway, reasons to breastfeed. Breastfeeding, breast is best if at all possible, but of course fed is the most important thing. So there is formula, but some advantages to breastfeeding here. It can help mom to heal after delivery. It can help with bonding, psychological things. But as far as baby is concerned, it can help baby because it has the exact amount of what baby needs. So it talks about fat and protein. It provides the right amount of calories, all the vitamins, all that good stuff, promotes healthy growth, protects against diseases. So there's some research to suggest that you have reduced risks of obesity, which can lead to heart issues, maybe even a reduced risk of cancer, that kind of thing with breast milk. Of course, all of that is correlational, but there is some research to suggest that it could be helpful. When it talks about tooth decay and jaw problems here, sometimes people misuse a bottle. So giving a bottle to children who are too old to get a bottle, or putting baby to sleep with a bottle and baby sleeping with a bottle all night long is not good for baby's teeth. So avoiding that whenever possible. It talks about digestibility. So babies are just not very likely to have things like constipation and diarrhea when they're being breastfed. And it does, to a certain extent, smooth the transition to solid food because breast milk takes on a different flavor depending on what mom has eaten. So it helps baby be prepared to try different flavors, whereas formula tastes the same every time. All right. Just a little bit more information, a lot to cover today. So when we're talking about nutrition during infancy, we have to mention malnutrition here. So we see worldwide about 1 in 4 children under the age of 5 are malnourished. Certainly we think about countries that are not developed, but this is something that also happens here in our country, in our culture. I would encourage you to look at the numbers for food insecurity in Mississippi in different counties. It's very astonishing. So you can imagine how malnutrition would cause potential issues. So it's going to cause problems with growth. So they may not develop, they may not hit their developmental milestones, may grow more slowly. Something that we also see is it can impact the personality or the temperament of children. So what we see is that children who are malnourished tend to be more quiet and inactive. They don't have the energy that other children have. And then because they are quiet and inactive, they're less likely to draw attention to their needs. And therefore, they may end up kind of having a cycle here where baby has not been fed enough, so then baby doesn't have the energy to fuss. And because baby's not fussing, baby doesn't get fed enough. And we have a cycle here. We see this, unfortunately, sometimes with children who are in orphanages when their crying has not brought them help because there are not enough adults to take care of them, then babies stop crying. And this can happen also with children who have been malnourished. All right, I feel like that's enough information for today. We'll pick back up with this slide starting during our next lecture video. If you have questions about anything that we covered today, please feel free to let me know. Also, don't forget that you do have Activity 2 coming up. So just let me know if you need anything. You guys have a great day.